So thank you very much for invitation, and I will try to show in a few slides, how we see this development, and of course the focus is on the primary health care, but from the kind of European Union angle, we have to look cross different developments in healthcare. Related issues, but of course, pandemic already was shown. This is much more challenged as just primary health care, and there are many links which that really help us, to understand better what's happened. But let's go to the next slide, where it's important. Statement was made recently by our president in her health union speech, when she said that this is also signal, this virus give the signal about the need for the, as she defined, this European Health Union. We got a number of lessons during this crisis. Many of them are related to the way we have seen disruption on single market access to medicines, to medical devices, to protective equipment, but also the number of decisions made by governments, not just central, but also regional governments, local governments, the way we build information channels, the way we were communicating, between different authorities, scientific bodies, and individual doctors. It's also was quite challenging. So the number of lessons learned, I will try focus on those. They are linked to health systems. So first, we learned that we have to build a health system more resilience to this pandemic, but also to the future crises. The bad news is that this pandemic continues. I mean, we don't see so far a light in the tunnel. But as many experts tell us, more future crises forecast were in our thinking. So this is when pandemic 2009 was over, when we took the lessons, one of the big question in 2010, 2011 was, do we have next pandemic very quick? And I don't think, at least I don't remember that many experts told us it would be so quick. But it looks like that the next crisis, this scale or smaller scale, may appear in the future. So we need to kind of rethink the way we build our health systems and prepare for the future crises. The other problem, of course, was what is the crisis preparedness and the crisis management capacity. We really understood that the preparedness is always, it's not easy, because you have to invest, in a number of areas, in people, in infrastructure, in knowledge, and then of course, it's not for sure this will come. For us as a medical professional, it's kind of normal that we live in almost every day on kind of smaller crisis with our patients, but in the scale of the system and global crisis like this, I think we really see this in our generation for first time. So the other big point I would like to make here is the investment in health workforces. We really understood that we need not just more people in the system, but also we need better trained people, better prepare for challenges they may come, and they can come again. So let's go to the next slide. So for us, of course, when you go and I direct now my thoughts to this workshop, it's nothing new, because we always say that the strong primary healthcare is essential for our patients. This is the statement we repeat. In many our debates, in our analytical work, in our policies. But of course, in the crisis like this, we again understood, how important this, especially for acute patients, but also for chronic patients. And I think this is something important, for our debate today. How to balance, this the kind of access and help to chronic and acute patients when, for example, hospitals are occupied with the COVID patients. We also understood the attention should be given more to the vulnerable groups. We started to define them as we learn more about this virus. So for the commission, the tool we are using to analyze the budgets and the way member states operating, of course, in the kind of budget constraints. This is called European semester. And in 2020, you can imagine that in spring, the health became really important area of concern, also from the budgetary point of view. So we analyze, together with our colleagues from different departments in the commission, what's happened, and the final results. Somehow it's here. So in one hand, we look on the pre-existing somehow challenges and structure issues which already were defined in all member states. And then, what of course came out of this analysis across continent in all member states, different, of course, ways, and there are a number of recommendation analysis in the field, that the shock given by virus really put many weaknesses of our health system in the light, and what again is show that resilience, should be established. So this is basically was number of recommendations went through this different direction. It's the really first time in the history of this exercise, health related recommendation, health system related recommendations were given to all member states of the Union. Okay, next, please. So how we see the kind of post-COVID challenges for health system. In one hand, we see the budget issues, inefficient financing for health investment. This not only for those countries, they have already this issue before, but also for countries the first time, were found themselves in difficulties to respond to the crisis and the needs of patients. We understood there needs to be additional strain of health system revenues, because it's not enough, in many health systems to have the kind of normal budgets. We need to get simply more money. Workforces, it's a quite challenging area because of shortages. It was very difficult to establish shift system in the hospital, but at the same time was quite challenging to make, for example, the doctors or nurses working in the ICU system, because they were not prepared. It was very clear assessed that simply you cannot swiftly start employ, let's say, dermatologists or other professionals, ICU specialists. They need to be trained. They need to be prepared. The care organization is other problem. The integration of healthcare is an issue in many systems, and of course in the crisis it's become even more important. Same, by the way, for social integration with the social care. The use of telemedicine already in the previous presentation, we have seen there was explosion of the phone calls or use of the telemedicine tools. But at the same time, there's a lot of unknown territories. One hand, acceptance by doctors or healthcare workers, but at the same time, acceptance of the system by patients. Patients were known sometimes by the difficult access to real doctor. They complain about the only availability of phone calls. So we have to also improve this system. Again, weak primary and ambulatory care, which simply when hospitals were blocked because of COVID or because of fear of patients going to hospitals, they couldn't find the right support outside the hospitals. Crisis response already mentioned, and of course the access to number of services, and there are more and more studies showing, for example, in cardiology, oncology field, the consequence of the system. I already mentioned the problem with the vulnerable groups. Next slide, please. So the primary care, again, we really believe that this is one more signal for all systems that we have to strengthen the foundation of primary healthcare, including emergency response. The continuity of care for chronic and acute patients is a key. We also should kind of make sure that we are able to facilitate the home-based programs, which I mean, the crisis showed that there's also a way to do things, but how to make this more sustainable is a question. How should be organized, how should be paid. Telemedicine is an important tool, but also we should see the limit, and also employ some kind of better technology and should be trained better for this type of services. And as usual, the coordination and integration of healthcare was a critical factor and should be improved. So just remind us, the situation on the on the workforces market. We see this sector is growing. We already are quite. The healthcare sector is the biggest employer across the continent. And we see the continued needs for more workers and different type of course professions and numbers and in quality. So this will be a continued challenge for all countries and the union as a whole, because we should not forget the freedom of movement of workforces in Europe is also a challenging factor. Next slide, please. So just last 3 slides. We try to employ also our experts. We have a so-called health system performance expert group. Try to understand better, how we can measure the situation and how we can help with number of the decision processes. So I will just show you the few reports. Please go next slide. So we already work on integrated care, already primary care and health system efficiency. You can have a look on these reports because there are a number, I think, good ideas there. They are developed by experts from all member states and with the help of OECD and Observatory of Healthcare Systems. And next. And recently, it was quite interesting because we wanted, we almost complete the health system resilience report beginning of this year. And when virus hit, we understood there are a number of new challenges. We are not yet ready to kind of accommodate all lessons learned from COVID, but there were some additional observations. They are included in this report. Will be published in few days, and we are working now on access to healthcare report, which is measuring also, at least we are trying to measure some kind of new ways this issue and take account the individual patient's view. And let me conclude with the last last slide, there are a number of funding available for the post-crisis, and especially in the new approach Commission took, and it is also supported by European Council. We will have money for recovery and resilience fund, which will support also post-COVID era. But there are many other programs. They are taking into account the lessons learned from this crisis, and it's important for healthcare system to really also to take a part of this development and make sure that we can use those resources to also prepare health system for the future challenges. So thank you very much, and over to you, Reinhard.